discussed in the last audio session. But in that audio session, because of the time restraint, I could not discuss about one important Guggulu Kalpa, that is Simhanad Guggulu. The name of the Ayurvedic generic medicine is Sinhanad Guggulu. As per my previous statement, Guggulu is basically the best drug for the Vata dosha. Vata is a bioenergy responsible for different types of movements in the body. That movement may be of physical in nature, like peristaltic movements. That may be the chemical in nature, that is neuromuscular conduction. Then they may be totally neurological conductions, like the activity of the motor nerves and sensory nerves. So all these factors are under control of Vata bioenergy or Vata dosha according to Ayurveda. Guggulu is the best for Vata when it is imbalanced. But try to understand, Vata imbalance is taking place because of the two main pathological situations. One situation is called as Dhatu Kshayajanya Vata Prakop. Dhatu Kshayajanya Vata Prakop, that means whenever there is a deficiency of one or many elements in our body, then Vata Prakop or Vata vitiation takes place. And another is called as a Margavarodhajanya Vata Prakop. That pathology has an inclusion of obstruction. So Vata or the movements can be disturbed because of some blockages. A simple concrete example is coronary thrombosis. Here the blood circulation is hampered to particular part of the muscle, cardiac muscle, and you get either angina or the infarction. So that blockage is called as a Margavarodhajanya Vata Prakop. But for example, if the patient's hemoglobin is low and he has a Vata Prakop, he has a tinnitus, sounds in the ear, he has a tremors, he has a breathlessness. So these are also Vata Prakop, Vata vitiation. But that is because of the deficiency of hemoglobin, that is Dhatu Kshayajanya Vata Prakop. Why I am repeating all the times this pathogenetical factor? Because the treatment differs totally. For Vata vitiation due to the deficiency, Dhatu Kshayajanya, treatment is nutritive. Treatment will be nutritive. That means you have to supplement the iron for the less hemoglobin. So you have to give something, and then Vata will be normal. But in obstructive pathology, you have to use some medicines or the dravyas which will destroy that obstruction. For example, when there is a heart attack, we give the injection streptokinase, that is thrombolytic in action. So that thrombolysis is a treatment of Vata as per the Margavarodhajanya Vata Prakop. I think even the non-Ayurvedic people will understand when I am giving such examples from the modern medicine. Then the concept will be more clear. If we used only Ayurvedic terminology, then sometimes it is very difficult to understand. Now I have started from the point as a Guggulu. So Guggulu is the best for Vata. But which Vata? Is Margavarodhajanya Vata Prakop. Because Guggul itself, that particular plant, that whatever the gum we are using, is a dry in nature, is scraping in nature, is little bit hot in nature, laghu in nature, light. So all these properties will be helpful to remove the blockages. So Guggul is the best for Vata, but not for Dhatu Kshayajanya Vata Prakop, but it is for Margavarodhajanya Vata Prakop. But there again I have mentioned, Guggul has another important property, and that is called as a catalyst. That means Guggul can be used even in Dhatu Kshayajanya Vata Prakop if it is mixed with the herbs or with the dravyas, maybe mineral dravyas, then that properties will be supplemented or carry forward by the Guggulu. I will give you the simple examples that I have discussed last time. Yogaraj Guggul is a typical for Margavarodhajanya Vata Prakop, because Trikatu, Trifala, all other Musta, all other dravyas are Margavarodhajanya they will nullify the Margavarod, they will remove the obstruction. But when you add gold compound, silver bhasma, Suvarna bhasma, Tamra bhasma, Loha bhasma, Mandura bhasma, so when bhasmas are added, that product becomes the Mahayogaraj Guggulu. So Mahayogaraj Guggulu can be used in both the conditions, in Margavarodajanya plus Dhatukshayajanya Vata Prakop. Today, in this audio session, I am discussing only one product that was remaining at that last time. It is the Sinhanad Guggulu. As the name suggests, Sinha is a lion. So Sinhanad Guggulu, as the name suggests, it's a product from Guggulu, compound product of Guggulu, and Sinha is a lion. I will explain why this particular name has been given. But first, let us see the contents of the Sinhanad Guggulu. Of course, the important contents is catalyst Guggulu. Then it is supplemented with Eranda Taila, that is the most important ingredient. It's a resinous oil or the castor oil. Ayurveda believes that resinous or the castor oil also best for Vata Prakopa, to balance the Vata dosha, to balance the movements. It's also the laxative. So it naturally makes the Vata Gati Anuloma. Then there is a Trifala Churna, is also the laxative, very same action to make the proper movements, peristaltic movements and all other movements, nerve conduction in a proper direction. Then it is supplemented with some Balya Dravyas like Suvarna Makshika Bhasma. They are like a tonics, Suvarna Makshika Bhasma. Especially they are useful for the patients of anemic condition. And overall, I can say in one sentence, Sinhanad Guggulu is the best medicine for many rheumatic problems. Sinhanad Guggulu or Guggulu products are mainly used for many musculoskeletal diseases. Musculoskeletal diseases. Different types of muscle problems, bone problems and joint problems. So it may be the rheumatic fever in the childhood from 5 to 15 years of age. It may be the rheumatoid arthritis from the age of 25 to 45. It may be the osteoarthritis, aging problem. Then there may be cervical spondylosis. There may be total backache. There may be lumbago. It may be the sciatica. It may be the ankle sprain. So different types of musculoskeletal problems can be sorted out by internally using Guggulu Kalpas and externally giving the Snehana and the Svedana. Snehana is a oil application, oil massage, and Svedana is a fomentation, giving the water steam, water vapor to that particular part. So, Sinhanad Guggulu is best for rheumatism, but according to Ayurvedic language, it is supposed to be best in the disease Amawat. Now there is a difference of opinions what should be considered by the word Amawat. 90% people compare it with the rheumatic fever. Personally, I don't agree with this concept, but anyway, some way it can be compared with the rheumatoid arthritis. Why? Because the fleeting arthritis is one of the feature of Amawat, as Ayurvedic people believes, because whenever that Ama moves. Now here, as the audience is also, listener is also the non-Ayurvedic, so I must explain what is Ama. So Ama is a toxin material, toxic material. It may be the endogenous toxin or it may be the exogenous toxin. For example, if there is an attack of bacteria, virus and fungi and infection occurs, that is also Ama. That is also Ama. That is created from external factors. But if the patient has a digestion problem, metabolism problem, and he has indigestion, anorexia, loss of appetite, constipation, gas in the stomach, abdominal pain, that can also be occur because of the improper digestion, and ahar rasa, the first nutrient fluid, becomes defective. It is with some toxin, and that is also called as a ama. So ama is nothing but toxin-like substance moving throughout the blood. And especially Amawat is a disease because that particular ama is little bit sticky in nature. heavy in nature, and that obstructs the different micro and macro channels of your body, and that you get the pain over there because the flow is not proper. There may be ischemic changes. So ama is one of the condition, and because of obstruction of ama, whatever the arthritic problem arises, that is called as Amawat in Ayurveda. Okay? So rheumatic fever is a post-streptococcal infection, as you know very well. After the pharyngitis, the child suffers 2 weeks back about the sore throat and cough and cold, and that becomes cured, or due to the haphazard treatment, that is incompletely cured, and that particular streptococcus cause the problems in your blood, and that becomes the rheumatic fever. One day the big joints are affected, the high fever is there, and that particular joint pain moves from one joint to the another. That is called as a fleeting arthritis. So this is the condition of even rheumatoid arthritis. Rheumatoid arthritis also, there is a moving from one joint to the another. Small joints are affected to begin with. I personally believe that arm condition can occur at any type of the arthritic conditions. Whenever there is a fever, that is one of the indication of arm. Whenever there is anorexia, that is also the condition indicating arm. Whenever there is a improper stools, that is one of the indication of the arm. As you know that the stools become the sticky, unsatisfactory bowel, and lot of smell is there. So all these conditions will indicate or will tell you that there is a condition of arm in your body. And to remove that arm, Ayurveda believes that Eranda Tail is the best medicine. Castor oil or the resinous oil, which is the main ingredient of Sinhanad Guggulu. And there is one shlok, just for understanding purpose, the listener can hear that shlok. Amawat gajendrasya shariravanachairanaha ek eva grahanirhanta eranda sneha kesari. So there is only one medicine, like a lion who can conquer the forest. There is only one dravya eranda which can conquer the arm in the body, and that's why the name Sinhnad Guggulu. The name is because of the castor oil. Eranda sneha is there in Sinhanad Guggulu. Actually, any fat substance is difficult to digestion, and then it will be said, already there is arm, why you are giving the sneha dravyas, why you are giving the fatty substance? But there is exception. Eranda sneha is the exception. What is exception? Although it is a fatty substance, it will not increase the arm in the body. Rather, it will help through the laxative or the purgative action to take off that waste product or the arm from the body or the toxins from the body. Do you understand? Naturally or in a normal sense, fatty substances are not advocated when there is a arm in the body. But Eranda sneha, castor oil, resinous oil is the exception for this condition, and which is the main ingredient of Sinhanad Guggulu. Okay? So because of the Triphala and Eranda sneha, your normal peristaltic movements takes place, bowels become clear. There is one Gandhaka also is there. Gandhaka, sulfur, as everybody modern science knows, that is antiseptic. But according to Ayurveda, it is amagna. It destroys the arm. It destroys the toxin from your body. Then, whenever because of this improper nourishment, the patient becomes debil or the weak, Suvarnamakshik Basma is there to support the normal body functioning. Suvarnamakshik Basma is a nutritive in function. So, Sinhanad Guggulu on the one side clears up the pathology, and on the other side maintains the normal health of the patient. So, Sinhanad Guggulu is one of the best medicine for Amawat. That means different types of arthritis whenever there is arm in the body, and another is for all sorts of musculoskeletal disorders. Especially it is used when there is a back pain, lumbago, when there is a cervical spondylosis, when there is a knee joint arthritis. You must use Sinhanad Guggulu with Dashamularishta. 2 tablets in the morning, in the afternoon, in the evening. 2 tablets of 250 milligram each tablet, 3 times in a day, with Dashamularishta. Dashamula, 10 roots. These different 10 herbs, the roots are used, and this is the best medicinal wine according to Ayurveda. Asvas and Arishtas these are the specific pharmaceutical preparations in Ayurveda. And whenever we are giving any medicine with some vehicle, the technical term in Ayurveda, scientific term in Ayurveda is anupana. If the patient is not having enough money, then in spite of Dashamudarishta, you can advise Sinhanad Guggulu 2 tablets 3 times in a day with warm water. Warm water is the best carrier, anupana, for any Vata diseases. Always remember, for Pitta diseases, milk will be the best anupana. But for Vata and Kapha, the warm water is the best anupana dravya, the carrier substance for the medicines. Okay, my dear friends, here I take a 5 seconds pause because we have completed all the Guggulu kalpas in the last and today's session. One kalpa was remaining at that time, Simhanad Guggulu, that I have discussed today. And today the main topic is, now what I am starting now, we will talk about different Virechana medicines in Ayurveda. I am talking this session Ayurvedic generic medicines part 6. In this audio I will discuss important 4 Virechana dravyas or the medicines, not the brand names. I am discussing only generic. Virechan, as I am repeatedly telling, Ayurveda has 5 cleansing processes, detoxification processes, that is Vamana, therapeutic vomiting, Virechana, therapeutic purgation, Basti, medicated enemata, Rakta Mokshana, bloodletting, and Nasya, that is nasal medication. These Vamana, Virechana, Basti, Rakta Moksha and Nasya are 5 important Panchakarma procedures. While performing these Panchakarma procedures, the concerned Vaidya should have the adequate knowledge, experience and skill. These 3 words are important for Panchakarma. Adequate knowledge. Number 2, experience. He should go to the different senior Vaidyas or the hospitals and learn all these techniques, because skill is very, very important. This is like a hospital practice. Even in the modern medicine, if you go, general practice is comparatively easy. But if you want to start ICU, then you should know how to do the central vein, how to do the rice tube installation, how to put the catheter. Everything one must know, otherwise they cannot perform. Similar is the here case, that whenever you want to perform Panchakarma, they are the invasive procedures, aggressive procedures, and there requires the knowledge, experience and skill. Because there are specific indications and contraindications when to perform which thing. In which patient we should give Vaman, in which patient we should give Virechan. That first we must understand indications and contraindications. As we are talking right now about Virechana dravyas, Virechan medicines, Virechan is a therapeutic purgation. And this is basically given to balance the problems with Pitta dosha predominantly, followed by Kapha dosha. Vamana is for Kapha predominantly and Pitta secondarily. In Virechan it is reverse. Virechan is basically for balancing vitiated Pitta dosha in the body. But it is also used for Kapha problems as well. So Pitta dosha and Virechan, they are very intimately related. Now when we talk about Pitta dosha, which Dushya or which Dhatu we should know, because there is a interlink between the doshas and dhatus. That interrelation is called as, in Ayurveda, Ashraya Ashrayi Sambandha. Relation in between dosha and dhatu is called in scientific term as Ashraya Ashrayi Sambandha. So Pitta dosha is connected with the Rakta dhatu. Pitta dosha is doing all its functions of digestion, transformation, metabolism, temperature regulation. All these are done with the help of blood circulation. So Rakta and Pitta, they are also intimately related. So Virechan is a management for Pitta dosha. Virechan is also the management of Rakta dhatu problems. Whenever there are problems with the Rakta Dhatu, you can use the Virechan Chikitsa. Some important things that I can quote. For example, in specific diseases it is mentioned that you must follow the Panchakarma. I will give the one example as Udara. Udara is comparatively called as a ascites. In Udara or the ascites, modern doctors, they always perform the abdominal tapping and they try to remove the excess peritoneal collection because the patient becomes dyspneic in ascites. And ascites is a usually complication from the liver cirrhosis. Whenever the patient is alcoholic, he first lands into the jaundice, then after repeated jaundice he becomes the cirrhotic patient, and after cirrhosis portal hypertension is increased and the patient gets the ascites, that is accumulation of fluid in the peritoneal cavity. And that is a very chronic disease, very troublesome disease and very difficult to cure. Even the modern doctors, they accept that we don't have the much to do with this. Only whenever there is a breathlessness, a lot of abdominal bulging is there, you come to the ICU, we will remove that fluid and again you will be settled down. But there is no as such long-term cure for that disease. But with the Ayurvedic management, you can better cure the ascitic patient, you can give the relief for a longer duration. I am not making a tall claim that you can cure the ascites. But what is the factor? If that fluid accumulation is going on repeatedly, then that you can definitely avoid with the Ayurvedic principles. Ayurveda believes when the fluid is accumulated, before that there is a peritonitis. So whenever there is a TIS, that is suggests the inflammation. And according to Ayurveda, each and every inflammation has a relation with Pitta dosha and Rakta dhatu. Pitta dosha and Rakta dhatu inflammation. Remember. So whenever there is inflammation, you can start the treatment with either laxative or the strong purgative. But here we are talking about the strong purgative. Virechana is a strong purgative. So for the minor complaints, you should not give the every time Virechan. For example, one day the patient is come to you and say, I am having doctor little bit retrosternal burning, abdominal burning, and you find that he is a patient of little bit acidity because of the little bit eating spicy food. Then there is no necessity that directly you can advise the Virechan for him. But whenever there is a complaint of chronic in nature, of longer duration, and you find that lot of dosha prakop is there, then only you can suggest the Virechana treatment of Pitta origin. In Udar, Ayurveda says, Nityam enam virechayet. Nityam enam virechayet. This is the Sanskrit. What is the meaning? For ascitic patient, you give strong purgative Virechan treatment every month, every fortnight, according to the patient's condition. But give repeatedly. That is the important. Another disease I remember. Pakshaghate Virechanam. Whenever the patient is hemiplegia and after 2-3 months after the acute episode is been over and residual damage is there, to correct that residual damage, you must advise him a moderate type of the Virechana. Then for all the Kushtha Vikaras, Kushtha is a specific word in Ayurveda which is used for all sorts of skin diseases. In a colloquial language, in a layman's language, many times there is a misunderstanding. Kushtha is equal to leprosy, according to the government's language. Indian government language, they say, translation in Marathi, leprosy, Kushtha. But in Ayurveda, no. In Ayurveda, Kushtha means all skin diseases. It may be scabies, it may be the bacterial infection, eczema, autoimmune, allergic conditions, it may be the psoriasis, it may be the vitiligo, it may be the acne vulgaris. Each and every skin disease is called as a Kushtha in Ayurveda. So for all Kushtha diseases, Ayurveda says Pitta and Rakta are main culprits, defaulters. So you can give the Virechan treatment to cure chronic skin diseases, especially weeping eczema and psoriasis. Third point of interesting Virechana, Ayurveda says there is a disease called as Rakta Pitta. Rakta Pitta is because of the wrong combination of Pitta and Rakta. Pitta affects Rakta, Rakta affects Pitta. Rakta Pitta. In modern comparison, it can be compared with different types of bleeding disorders. Bleeding disorders. For example, epistaxis, hematemesis, hemoptysis, that is the bleeding from upward part. Epistaxis from the nose, hematemesis from the vomiting, hemoptysis from the sputum, from the downward passage. Hematuria, blood from urine. PR bleeding, bleeding through the rectum. PV bleeding, the menstrual disorders. Purpura, bleeding through the skin capillaries. So these are the different varieties of Rakta Pitta. One of the interesting treatment for Rakta Pitta, there are three types of the Rakta Pitta. Urdhvaga, from upward, Adhoga, from the downward, and Tiryak. Ayurveda says the treatment policy. Pratimargam cha harayet. Pratimargam. That means bleeding is from upward. You give the cleansing treatment from the downside. That means if you want to control the hemoptysis, better give the Virechan. If there is a patient of epistaxis all the summer season, he is getting bleeding from nose, better try for the mild Virechana dravyas. If there is a bleeding from the downward, PR bleeding, or the menstrual disorders, you give the Vamana. Pratimarga. Pratimarga is opposite direction. You have to control the bleeding with giving the cleansing process, Panchakarma, with the opposite direction. I think this is also one of the important Ayurvedic principles. You must understand. Now, which are the Virechan dravyas we are going to talk about? First is Ashwakanchuki. Second is Icchabhedi. Third is Narachras. And fourth is Udarari Ras. All these are the strong purgatives in ascending order. Ashwakanchuki is a mild form of the Virechana. Icchabhedi, more stronger. Narachras, still more stronger. And Udarari Ras, very strong in all these four. Remember Virechan dravyas, Ashwakanchuki, Icchabhedi, Narachras and Udarari Rasa. We will go one by one. All these are, especially Ashwakanchuki, Icchabhedi and Narachras, are Jepal products. Jepal is the name of the herb, Croton tiglium. And Jepal is a Tivra Virechana dravya. So let us start discussing about Ashwakanchuki. What are the contents and indications? Ashwakanchuki, that we are going to discuss to begin with. The mild Virechana dravya. Actually, this is very difficult to understand any meaning from the Ashwakanchuki. Nobody knows why this particular name has been given, because this is typical name. But this is a Jepal and Bachnag. The main ingredients are Jepal, Bija, one part. Bachnag is there. And most important, this is Rasakalpa. So whenever I say Rasakalpa, it is with mercury and sulfur, which together, when it is mixed, it is called as a Kajjali. The compound product of Paragandhaka or mercury and sulfur is called as a Kajjali. And that is the best catalyst and also best preservative to preserve that formula. Then there is also another dravya like Triphala, which helps to the Jepala Bija. All the formulations of Ayurveda, they take care of Agni. So you will find that nearly 70 to 80% Ayurvedic generic products, they contain the Triphala and Trikatu. So Triphala is basically to make the Vatanulomana, and Trikatu to stimulate the digestive fire or the Agni. So in many kalpas, there you will find the Trikatu and Triphala. Then another important thing, whenever you find Aconitum ferox, Bachnag, there is an antidote. And that antidote of Bachnag is Tankana, borax. Tankana, lahi, is an antidote of Bachnag. So whenever you find in any kalpas Bachnag, you will find the Tankana lahi. Then there is a Bhavana dravya of Maka. Maka is a herb that definitely take care of liver. It is acting best on the liver. Maize. In modern English word, it is maize. So we use the juice of maize, M-A-I-Z-E, Maka Rasa. The Bhavana Dravya is a Maka Rasa. So 125 milligram tablet is taken only once in a day in the morning and only one day. That is a Virechan Kalpa. Now what are the particular properties of different elements? Paragandhaka Kajjali is antiseptic, and Yogavahi, that is catalyst, and also Rasayana. Then Bachnag and Takanakhar, they are anti-inflammatory, analgesic, and they will also make the action very fast. That is Vyavai and Vikasi according to Ayurveda. Vyavai and Vikasi are the properties which explain you that the drug is acting very, very quickly, very fast. Then there is also Hartal. Hartal is also useful to remove the blockages from different micro and macro channels. Hartal is arsenic compound. You know, Hartal is a yellow arsenic compound. It is also Tikshna and Ushna. Then I have explained you about the Jepala Bija, which is also Tikshna, Ushna, Vyavai, Vikasi, very strong purgative and removing the obstruction. So let us see in which conditions it can be used. Ashwakanchuki, I am giving the list of indications first and then we will discuss little bit. First is a bronchial asthma. Second is a CCF, congestive cardiac failure. Third is Udara and Shoth, that is ascites and edema. Fourth is a Kushta Roga or skin diseases. Fifth one is Apasmar or epilepsy. And sixth one, that is Vishamajvara or the intermittent fever, a type of the malarial fever, that is Vishamajvara. So in all these conditions, these Virechana Dravyas are useful. Let us see one by one in Shwasa and Kas, Ayurvedic words. But remember, the bronchial asthma with profuse expectoration only, this will be useful. If it is a dry asthma, you should not advise the purgative. Then you can give the laxative, a mild, like for example, Haritaki Kalpa, like Abhayarishta, Swadishta Virechana Churna, Avipattikara Churna, but not strong purgative. But whenever there is a bronchiectasis, a lot of profuse expectorations are there and blockages is there. Prana Vayu, according to Ayurveda, Prana and Udana Anuloman is disturbed. So why? Because there may be some problem with the Apana Vayu. So when you cleanse up the Apana Kshetra, it will also make the effect on the, reflex effect on the Prana and Udana. That is upward control is there. So whenever there is a profuse expectoration of white color, yellow color, and it is not controlled by your normal anti-asthmatic management, then best you try for Virechana Kalpas. In bronchial asthma with expectoration, underline the word with expectoration. Second is a Rudroga, especially right ventricular hypertrophy or right ventricular failure, because there may be problems like hepatomegaly is there in this particular CCF patients, because the back pressure is there on inferior vena cava and superior vena cava. Of course, this right ventricular failure or right ventricular hypertrophy is also a complication with COPD, chronic obstructive pulmonary disease like bronchial asthma. So next step will be the right ventricular failure. We call it as a CCF. So there is also the Srotorodha obstruction in the Srotosads, micro and macro. There also you can try for this Ashwakanchuki purgation. There is edema on the leg which is called as a pedal edema. That everything can be controlled. The further complication, first COPD, then right ventricular failure, and then comes the cirrhosis, and then comes the ascites. So here in the cases of Udara and Shotha, there are different types of the Udara. Ayurveda explains Vatodara, Kafodara, Yakrit, Dalyodara. Plihodara, Jalodara. So especially in the ascites and also the anasarca, edema all over the body, with the origin of liver, you must try for Ashwakanchuki Virechana, because there is also the dosha sanghat, or the compound pathology with the doshas are strong. So whenever there is a ascites originating from liver or originating from heart, you must try for this Ashwakanchuki Virechana. Next is a Kushtha Roga, skin diseases, especially chronic and kapha dominant. Kapha dominant is important. Inflammation is there, secretions are there. Itching is the most indicative of kapha involvement. So skin diseases with indigestion, you can definitely give the Ashwakanchuki Virechana, only one tablet in a day, remember. But as I am repeatedly saying that any panchakarma, you will need the 3 steps like any operation: pre-operative, operative and post-operative. In this particular Virechana also, Purva Karma, Pradhana Karma and Paschata Karma. 3 steps nobody should forget. And in the Purva Karma, we give the medicated ghee or the oil internally. So there is oiling, there is lubrication before starting any panchakarma. So that steps are very important. Otherwise you will be failed in that particular management. And Paschata Karma is a specific dietary advice and lifestyle advice. That conditions you should not forget while giving the Ashwakanchuki Virechana. So weeping eczema, psoriasis, scabies, any allergic condition, especially I am talking about urticaria. Urticaria is such a troublesome disease. It remains in the body for years together. The people do many allergic tests and so many allergens are found, like pollen allergen. Some are having dust allergen. Some are having fumes allergen. Some are having the peanut allergen, egg allergy, fish allergy. So many allergies are there. But what is important? All allergies are happening with you only because your body is impure. The patient's body is impure. That's why his immunity is low and that's why he is getting affected with allergic conditions. So any allergic conditions, you must advise the panchakarma like Vamana or Virechana. Here we are talking about Virechana. So urticaria, when we have a chronic urticaria, we always prescribe either steroids. First we start with the levocetirizine, simple anti-allergic. Then we start with the Visolon, prednisolone. And sometimes we give the hetrazan, ethyl carbamazepine, when there is eosinophilia. Temporarily it is relieved. Hetrazan, 21 days course, 1 tablet 3 times in a day, 100 milligram tablets. But sometimes there is again recurrence. But in these cases you must try Ashwakanchuki Virechana. Do you understand? Next is apasmar. Now again there is a confusion. The modern people ask, apasmar is epilepsy. Epilepsy is concerned with the brain. And why you are giving the Virechana? They don't know the Ayurvedic pathophysiological aspect. Because Ayurveda believes that apasmar is also connected with the disturbance of Vata with the Margavarodha, is a Srotorodha. There is an obstruction in the conduction phenomena. Electrical conduction is not proper. There is a Margavarodha, there is obstruction. And that's why Ayurveda says, whenever there is obstruction, Virechan will make anulomana gati, Vatanulomana. What is exactly mean by Vatanulomana? Vatanulomana will take place not only in the large intestine. Vatanulomana will take place in every micro and macro channel level. Vatanulomana. Your peristaltic is okay, they will understand, modern doctors. But your respiratory rate is also adjusted. There is a rhythmic movement, inspiration and expiration. That is getting disturbed. That is also correct. That is called the Vatanulomana. Your heart, arrhythmia. The modern doctors, they use the word arrhythmia. Arrhythmia, what is that? Vatanulomana is disturbed. Try to understand the words. Vatanulomana. Anulomana means the proper directive movements of the Vata dosh, Vata bioenergy. I am repeatedly telling you, these movements are physical movements, biochemical movements, neurological movements, neuromuscular movements. Any movement is because of the Vata dosha in Ayurveda. That's why in apasmara, whenever the patient with the kapha predominant complaints, Ayurveda believes not all the epileptic patient in a one eye. We look each epileptic patient in a different angle. Okay, in all the patients, there will be fits, there will be convergence. But Ayurveda says, which are the other complaints? What are the other complaints? That is most important in Ayurveda. Okay, apasmara is a Vata disease. But what is the adjoining features? Many patients, they start, we don't have any very good appetite. I am always having in my past, I am always suffering from acidity. I am always suffering from indigestion. This is my history. Modern doctors, even modern neurologists, with due respect to their knowledge, they don't inquire about the past history of digestion. Because they don't have any link in their science. They say it's only the here, brain problem, only, forget. You do the EEG, find out what is the problem, whether it is tumor, whether it is accident, finish. But Ayurveda, no. Ayurveda says we should understand his other factors of the body. And here comes the importance of Ayurveda. In addition to the Vata problem, what are the other problems? So if there is attachment of kapha dosha, for example, if he is an old indigestion patient, irritable bowel syndrome patient, chronic colitis patient, Ayurveda says no, it has link with apasma. How and what? That is something different, research topic. But yes, and then Ayurveda suggests, okay, we will give the Vatanulomana by Virechana and that epileptic fits will definitely come down. This is the assurance given by the science and not by the Vaidya. Ayurveda has this particular pathophysiological aspect. It is something different. It is very difficult to understand. But if you think and if you see the results, then we agree. So here what I want to say, first you try at least to give the Virechana, Ashwakanchuki Virechan to the epileptic patient who are having the problem of kapha dosha, chronic indigestion problem, like Agnimandya, anorexia, laziness. Then here in proper way you can give this particular Ashwakanchuki Virechana. Of course, I am not saying this is the only treatment. Ayurveda always believes that there is a dietary control, lifestyle management. So this patient particularly needs also the fresh air, enough exercises and simple and normal diet. Sixth indication for Ashwakanchuki Virechan is a Vishamajvara. Whenever there is a chronic fever, there are chances of hepato and splenomegaly. Hepato and splenomegaly is common in the chronic fever patients. There is also a problem with the constipation. So what is happening? Because of the Virechana, normal bile secretions takes place. Normal digestive secretions takes place. And naturally Vatanulomana will take place and the episodic occurrence of that fever will come down. That recurrence will definitely go down if you keep his normal digestive tract in a very proper rhythmic way. You understand? This is the Ayurvedic psychology or Ayurvedic pathophysiology. But remember, you must understand that Ashwakanchuki Virechan should be used whenever there is a dominance of kapha prakopa, number one, and congestive type of the disorders. Although it is also mentioned that any Virechan is helpful for Pitta dosha, but that is not a generalized rule, remember, because Virechan itself is an aggressive treatment. So Pitta dosha also, when it is a Sama Pitta, then only you can use this particular Virechana. But when the Pitta Pradhana Prakriti is there, patient is of Pitta dominance, like for example, if he is complaining of burning sensation all over the body, then if he is a very weak, loss of weight is there. Do you understand? If there is a bleeding through the rectal region, then it is not advocated that you should give the Virechan, because Ashwakanchuki will itself make a complication in these patients of Pitta dominant complaint or Pitta dominant patient. What complaints will be arise? He will start some hematuria. He will start the PR bleeding. Because originally Pitta is hot and we are taking out some toxins but with the water. So naturally there is a depletion in the body, and that depletion can make more heat in the body. So you should be very careful while giving Ashwakanchuki Virechana. See that the person is enough strong. Ayurveda it is called as an indicated patient. Virechana, then only you can give very debil patient. Loss of weight is there because of the cancer, because of the tuberculosis, any chronic illnesses, and the weight has been drawn out. Then you should not advocate the Virechana by Ashwakanchuki. Okay, it is a Pitta dosha, but then you can use the very, very, very mild laxative like Aragvadharishta, enough. Swadishta Virechana Churna, enough. Amalaki Churna, enough. Trifala Churna, enough. That Pitta dominant patient, remember. Is it very clear? So this is all about the Ashwakanchuki. Now we will go further to understand the Icchabhedi. In Ashwakanchuki, Icchabhedi and Narachras, the Jepal quantity has been increased. In Ashwakanchuki it is only one part. In Icchabhedi it is a 3-part. And Udarari Rasa, Naracha Rasa, it is 9 part of Jepal. So it is gradually increasing is there. Now we will try to understand the Icchabhedi Ras. As this particular Virechana is making our desire successful, that's why it is called as the Icchabhedi. To complete our Icha is a desire. It is completed. So Icchabhedi Rasa, that the patient wants the relief from his complaints, from his constipation, from his indigestion, and his desire is completed. That's why it is called as a Icchabhedi Ras. It is also the Jepal product. Many ingredients are same, like Paragandak is there, Kajjali. Here actually Bachanag is not there, but Tankana is there. Trikatu is not there, but Shuntha and Maricha is there. Ginger and black pepper is there. Gandak is there, like Ashwakanchuki. And Limburas, Bhavanadravi is not Maka, it is Limburas. That is lemon juice. Now what are the effects? Paragandak Kanjali, as I am saying, Yogavahi, catalyst, and Krumigna, that is antiseptic. Jepal Bija, seeds of Jepal, Croton tiglium, is very strong purgative. Shuntha, Maricha and Tankana. Shuntha, ginger. Maricha, black pepper. Tankan, borax. are Deepana and Pachana, appetizers and carminative, and Shulahara, that is antispasmodic. Lemon juice, Limburas, is Deepana, Pachana, Anulomak, and Vatashamak. Again, try to understand, in all Virechanas the indications may be little bit same. Ashwakanchuki, Icchabhedi and Narachras, more or indications will be the same. But still I will make a list of those indications. First is again Udara and Sarvanga Shotha, as we have already discussed, ascites coming from the cirrhosis, and also the edema all over the body. Here we can use this Icchabhedi. It is more stronger than Ashwakanchuki. So the patient should also be more strong. His disease also should be more strong. His disease also should be more chronic. So three things I am explaining. Patient is strong, disease pathology is strong, chronicity is more. So naturally you have to use the Ashwakanchuki first, then Icchabhedi, then Narachras, and then Udarari Rasa. Only difference is that you have to select the patient, proper selection. First indication of Icchabhedi Virechan, ascites. Second, as I have explained, bronchial asthma or the breathlessness and cough with much expectoration, like bronchiectasis patients. Then third is, we have already discussed about apasmara and unmada. One addition is there. Unmada is a similar convulsions with hysterical problem. Hysterical fits are called as unmada in Ayurveda, and apasmara is a epileptic fits. Kushta, as we have already discussed, but the new additions are prameha. Try to understand. Prameha is also the problem with kapha and kleda. This is typical word from Ayurveda. Diabetes mellitus is a disease with lot of metabolic problems. Although it is a carbohydrate metabolic disorder, the basic thing is happening that you are getting some toxic material inside the body which is not expected. Like kleda, for example. Kleda is the word used by Ayurveda to indicate very, very minute waste products created during tissue metabolism. This is totally scientific term in Ayurveda. What is kleda? It is a watery waste product created at the level of damaged tissue metabolism. So carbohydrate metabolism is disturbed. So there should be some waste product, and that is denoted by Ayurveda as a kleda. And that is also the congestion problem, margavarodhajanya prakop. So you can also use, when indicated in the prameha patient, this Itchabhedi Virechana. Okay? Then urdhvaga rakta pitta, as I have already discussed, gamcha harayet. Whenever there is epistaxis problem, you can use the Itchabhedi, but that should be given in pitta pradhana vikara, pitta dominant diseases. You can use the anupana, not only lukewarm water, but you can use draksha or sugarcane juice. But as like Ashwakanchuki, there are contraindications for Itchabhedi as well. And one of the important contraindication is, you must understand the strength of the patient. If the patient is having less strength, physical as well as mental, less weight than expectation, then if the particular patient is pregnant, lady is pregnant, the child is very small, below the age of 15 years or the 10 years, then there is a loss of weight loss, muscular atrophy is there due to the cancer, tuberculosis. You should not give the Virechana, because then it can cause the shock-like problem. Like hypovolemic shock will take place if you do not select the proper patient. Itchabhedi can make you harm for your practice, for your reputation, if you are not careful while using the Itchabhedi Virechana. Especially you have to also consider the Koshtha in Ayurveda. Koshtha is a sensitivity of your large intestine. Sensitivity. Some are very sensitive. Like 1 cup of even milk, 1 cup of the grape juice can make them lose motions. In Ayurveda it is called as the Mrudu Koshtha. Some have very, very stiff type of the colonic structure, anatomical and physiological, and they will not be affected by your normal laxatives. Even 2 dulcolax will not make anything for them. That is called as a Krura Koshtha in Ayurveda. They will require very strong purgatives. So what I mean to say, this particular Ashwakanchuki Icchabhedi should be used very carefully in the patients of Mrudu Koshtha. This is like a caution. Then there will be chances of hypovolemic shock. So whenever you are trying for Itchabhedi, and if it is not properly indicated or given, then there are patients, they will land into the hypovolemic shock. There also, according to Ayurveda, you must give the oral rehydration like lemon juice, buttermilk, then also the ghee and particular sugar, and also you can give the stambhaka dravya like kuda, Colarina antidysentrica, lodra, lodraso. So this type of the treatment, which is called as a treatment for your complications. So I am saying that treatment for complications. One, you can give the IV fluids to begin with, and otherwise also after second, third day, to reduce the effects of that strong Virechan, you can try for this lemon juice, fresh buttermilk, ghee and sugar, etc., etc. Also in emergency, Ayurveda also talk about emergency. Ayurveda recommends Suvarna Suta Shekhar. Suvarna Suta Shekhar or Suvarna Malini Vasanta. These are the 2 medicines that can be rubbed in the honey and give the licking purpose. Satana in Ayurveda it is said, lick on the tongue. That can also take care of the following pulse. following BP that can be rectified by giving these tablets like Suvarna Suta Shekhar or Suvarna Malini Vasanta. So we have talked about the complications of Itchabhedi Virechana. Now we will go further. That is called as a Narachras. That is called as Narachras. This is the advanced stage of that particular Ashwakanchuki Icchabhedi. It also contains the Jepal Bija, Paragandak Kajjali, Trikatu, and also the Tankan. So because each and everything is very similar that we have already discussed about the Icchabhedi. There is not much difference. Only the quantity of Jepal Bija is increased as a 9 times. In Ashwakanchuki it is 1 part Jepal Bija. In Icchabhedi it is a 3 part. In the Narachras it is a 9 times more. And now we will talk about maybe the last one, that is Udarari Rasa. Udarari Rasa is also the strong Virechana. It contains also the Paragandak. Better way, it has only the Para in Udarari Rasa. Then there is a Jepal Bija, Bhava. The most important is a Morchud is there. Morchud. Morchud is compared with the copper sulfate. So it is a copper product. And you know that copper metal is very, although we are using purified copper or purified Morchud, but still it is a strong scrapping drug. So it will be giving very, very strong effect of that your purgation. So be careful because it contains Morchud, and it also has a Bhavana Dravya as a Tridhari Nivadunga. Tridhari cactus. Tridhari Nivadunga chick is a Bhavana Dravya. And this is also very strong purgatives. And that's why it is always said that Udarari Rasa is the last option for your Virechana whenever the patient is only and only of Jalodara or the Yakrut Dalyodara or Plihodara, then only better you use the Udarari Rasa. Not for any other complaints that we are indicated in Ashwakanchuki or the Icchabhedi. We have written Kushta, we have written the Udvar Rakta Pitta. Better way, don't use Udarari Rasa. Udarari Rasa should be reserved only for the ascites, remember. Here, basically, we apply the resinous oil or Eranda Sneha to the abdomen, and to reduce the frequency of abdominal tapping, we give this Virechan, and after giving the Virechana, there must be abdominal belt that we advise to the patient. That is most important. To avoid the recurrence of accumulation of that fluid, give some belt. Like after pregnancy also we advise the patient, lady, to use some belt. Because to improve the muscle tone of that particular part. So abdominal belt is indicated, and then internally also we give some medicines, but the basic thing, we keep that patient on the milk diet. This is a very specific treatment by Ayurveda. To treat the patients of ascites, we give the always repeated Virechana, and also we keep the patient on only and only milk diet. Remember, modern doctors, they use the diuretics, but we don't use the diuretics much. We give the Virechana, purgation, and on the milk diet. And that gives a very fantastic results. But as I am telling you that this is a strong purgative, you should not use for other indications of Ashwakanchuki and Itchabhedi, because even this should not be used when there is a severe burning in the body, high fever is there, inflammation is there, and very, very pitta dominating symptoms. If the patient is suffering from strong pitta prakopak lakshana, pitta dominant symptoms, better don't use this Udarari Rasa, because that can make us very severe complications. And if the patient getting hypovolemic shock, in addition to the IV fluids, as a diet, the patient can be recommended to take little bit curd and rice and curd, that can be used to protect from the different complications of Udarari Rasa. So I hope that in this particular audio session of 1st June 2018, that is on Friday, we have to begin with talked about Simhanad Guggulu, which are the product left from my last lecture, because in the last lecture I have discussed all Guggulu kalpas, only one was remaining. So I have completed the Simhanad Guggulu, which is the best medicine for Amawat, which contains the erend. And then we have started with Virechana dravyas, and we have completed the Ashwakanchuki, Icchabhedi, Naracha Rasa and Udari Rasa. Remember, Udarari Rasa, there is also another name which is called as a Udarari Rasa. Udarari Rasa. So all these tablets of only 125 milligram, and it has to be taken after the Purva Karma with internal Snehana dravyas. And also only one tablet, only once in a day, early in the morning, so that for the whole day, nearly 10 to 20, you can say the loose motions takes place, and all the doshas and the toxins, they go out of the body, and whatever the symptom complex is there, that is broken down, and recurrence and the intensity is definitely reduced after you give the Shodhana Karma like this Virechana. So I thank you very much for your patience hearing, and I wish you all the best. We will meet very soon with some